Time. Let's take a listen to Green Senator Richard Di Natale. He's been just speaking in the last 15 minutes or so at Parliament House, following comments by Australia's Chief Medical Officer about the government's Ebola preparations.
That is not the definition of a government that is ready and willing to help. We also heard, just as critically, that now the UK have made a decision that they will no longer evacuate their own health personnel from Africa because they're concerned about the aircraft journey. Even though it's much shorter than Australia, they're still concerned about it. And in fact, what is happening right now is we are building health facilities in West Africa that will be ready in a matter of weeks. And the UK has made a decision that their health personnel will be treated in the field. We don't have this excuse now of not being able to evacuate people to Australia. That excuse is gone. If we were to send our health personnel to have the training they need tomorrow, and by the time that's done, they could be sent to West Africa to fight this epidemic at its source and be treated in the field should they need it. It's what the UK's decided to do. Well, there are no longer any excuses. And I can tell you, as a public health specialist who's worked in infectious diseases, every day you wait means that 1 or 2 cases becomes 10, becomes 20, and before you know it, you just don't have the capacity to contain this thing. And if it does come to our region where we have failed health systems, like in PNG, we won't be able to control it. So the government doesn't have excuses anymore, and I'm calling on the Prime Minister, the Health Minister, to immediately deploy our AUSMAT team to have the training that they need and to no longer hide behind this excuse of not being able to evacuate them, because we know that's no longer a factor. These facilities are being built in West Africa and will be ready in a matter of weeks. That evidence was provided by the Chief Medical Officer today, and so we have an obligation here. We have an obligation, a moral one, when we look at almost 1 million people projected to be infected, in fact over more than 1 million, the UN are suggesting now. When we look at what it means for our region and the capacity of our health systems to be able to contain it, and indeed what it means for our country. There aren't any excuses. The US are doing it, the UK's doing it, Cuba's doing it, China's doing it. We've got countries right around the world who are committing health personnel. We need to ensure that we combat what the UN have already said is a bigger threat than global terrorism. No excuses now. I want the Prime Minister to immediately confirm he will deploy those troops to have the training they need, and then to ensure that they're sent to combat this outbreak at its source. Because let's remember, the most effective way of ensuring this doesn't come here, this doesn't come to our region, is to combat it at source. And every day delayed is another day where this becomes more and more unmanageable.
This issue has also been raised in the Defence Committee this morning. Jackie Lambie has raised the prospect of something like Ebola-infected suicide bombers. Is that sort of, are those sort of questions, or is that sort of debate helpful?
No, it's not. No, I mean, that's not my concern here. My concern is we've got projections that over 1 million people are going to die from this thing. That's what I'm concerned about, is that we have, a global catastrophe occurring right now, and we're too slow in responding. There are so many dimensions. I mean, there's a moral dimension here. Are we going to sit back and watch over 1 million people die? I mean, I heard people talk about the response to the Rwandan genocide, and I've heard the former US president, in reflecting on that, talking about one of his great regrets in office was not acting more quickly. Well, what we've got here is akin to that in terms of the impact it's going to have on the lives of ordinary people. There are hundreds of thousands of people who'll die if we don't start acting. There's also a national interest here as well. This is a disease, and I don't want to be alarmist about it. I think if you're a country with a well-developed health system, containment is much easier. We know it's not as infectious as some other things, like some forms of influenza, but of course the problem is it has a much higher fatality rate. I think if it came to Australia, we'd manage it, we'd get on top of it. But if it comes to PNG, if it comes to some other Asian countries who just don't have the containment capacity, we're talking about the numbers growing exponentially. This is an enormous crisis right now, and we're sitting on our hands. We've got the government running around saying, oh, don't worry, we've got people who are ready, should it come to PNG. We've got press conferences in PNG with the Prime Minister saying, we're here to look after you. We haven't trained people. We don't have anyone that we could send if there was an outbreak tomorrow. What have we been doing? This thing has been going on for months, and we haven't had the foresight to send our AUSMAT team, that is the doctors, the nurses, the logisticians, to Europe to have the training they need to have in this very specialised illness. If you're going to go to West Africa with MSF, with Oxfam, there is a 2-week program with very intensive skills development in terms of ensuring you know what protections you can take for yourself and, in fact, what sort of responses are necessary. We haven't done that yet. I would have thought that'd be the first thing you do. If you're a country that says you're ready to do this, you train people and make sure that your professionals can be deployed tomorrow. And then, of course, there's this myth about, well, we can't evacuate them. The UK are no longer evacuating people. They're treating them in the field because they...
OK, we're just breaking out of that there. Green Senator Richard Di Natale, the opposition leader Bill Shorten and Jenny Macklin just beginning a media conference.